comes to your mind when you hear the word mathematics? Is it the intricate patterns woven into nature and technology? The quiet language that speaks to the stars, the seas, and the people? Math, the silent architect of the universe, connecting all things with reason? Or is it something else? A blur of numbers and formulas, tiring, tedious, boring, even impossible. But what if math isn't just about formulas and figures? What if it's behind every life-saving decision, from calculating precise dosages to interpreting lab results? In every heartbeat counted, every breath measured, every single diagnosis made, math is there. Not just numbers, but of healing, of hope, and of life itself.
So, Gab, you decided to take up nursing, right? What made you do it?
Well, my first thought was there wasn't really any numbers on it. And I really hate math.
Wait, so you're telling me that you took up nursing to avoid math?
Hey, I'm serious. I hate math. When I heard that they only teach medical terms and patient care, I was really excited because I don't really like numbers.
Well, it's actually the opposite. Math is really everywhere in nursing. You're going to need a lot of it.
Wait, seriously? Are you telling me that I'm going to use math while treating patients?
Yeah, definitely. But don't worry, it's not about algebra or calculus type of math. It's more on practical math. The kind of math that helps you save lives.
Well, I guess that makes sense. I just really can't believe and wrap my head around that nursing math.
No worries, I got you. For example, imagine a student nurse monitors a patient's vital signs every 4 hours on a graph.
That makes sense.
No, I'm not. I've had such a hard shift. How about you? What are you doing?
I'm plotting the patient's temperature. Condition now.
That's a really big steep. Are you sure that's accurate?
Yeah, I just took the patient's temperature right now, and I'm getting worried.
Are you sure? Maybe you're plotting it wrong.
No, I'm really sure. I just took it, right? I've been careful with each reading. It's just his temperature is going up faster than I expected. The nurse before me plotted at 8 o'clock in the morning, and it was 36.8. And then I plotted at 12 o'clock, which rose up to 38.1. And then just recently, at 8 p.m., it reached 39 Celsius.
Well, yeah, that makes sense. Was there a medical order issued for this?
Yeah, I just got it. I'll be preparing his medicine now.
Okay, good luck. You look like one of the patients here, so you better fix yourself.
Okay.
So from what I understand in the scenario, am I really going to use math to plot graphs?
Yeah, we chart the patient's temperature over time, and by plotting it on a graph, we can spot trends, whether it's rising steadily or spiking suddenly.
Ah, I see. So we're looking at the rise of temperature to see what's going on with the patient.
Exactly. The math helps us track how quickly things are changing. If the temperature keeps rising quickly, that's a sign we need to act fast.
So when we see a temperature rise, we can use it to calculate how much it increases per hour to know how serious the condition of the patient is. Am I right?
Yeah, it's about spotting patterns, whether the fever is escalating, staying steady, or even improving. That gives us insight into the patient's condition.
Hell yeah! I get it now!
Okay, so let's imagine another scenario. Where two nurses are comparing regular readings and elevated readings of a patient.
Hey Andria, check out the blood pressure here. It's 160/95 millimeters of mercury. That's a bit high, don't you think?
Yeah, that's definitely above normal. Anything above 140/90 is considered to be hypertensive, right?
Exactly. For someone this age, that's a pretty significant reading. Should keep an eye.
Definitely. I've seen in class that consistently high BP can cause damage to the blood vessels and increase the risk of stroke or heart failure. But let's see if the other vitals have explained this. So what's the pulse rate?
It's 110 beats per minute. That's higher than normal too, right? The normal pulse rate should be between 60 and 100 beats per minute.
Yeah, it's elevated. A high heart rate can happen if the patient is under stress, pain, or if they've been moving around a lot. But I'm wondering if it's related to high blood pressure. Sometimes those two are related.
True. A fast heart rate is definitely something you should check. It might be compensating for the high BP, but let's check the respiratory rate too. So, what's the RR?
It's 22 breaths per minute. The normal range should be 12 to 20 breaths per minute.
That's a bit above the normal range too. Exactly. They all be connected to high blood pressure, increased heart rate, and faster breathing. They could all be signs that the body is under stress or strain, and we need to keep monitoring these numbers and make sure we're not missing anything.
I wonder if we should check if the patient's been feeling any chest pain or shortness of breath. Those could be signs that these vital signs are bigger risk. But for now, it's good that we're not missing these changes.
Yeah, definitely. It's all about tracking these trends. If these numbers stay elevated, we'll need to inform the clinical instructor. It's important to compare these vitals to what's normal for the patient so we can track their health.
Right, we should definitely tell the attending about it.
Okay, let's go ahead and report it.
Let's go.
Hey CJ, in that scenario, how does math really get the picture exactly?
So, the main concept here is how we use math to compare elevated readings with normal readings. So, we start with normal ranges. Like normal blood pressure is around 120/80 mmHg. This patient's is 160/95 mmHg. So, we can just subtract to see how much higher it is.
Right. So 116 minus 120 for the systolic, and 95 minus 80 for the diastolic. That's 40 higher from the top number, 15 higher from the bottom. Am I right?
Exactly. That tells us just how far off the patient's blood pressure is from what's considered normal. We can track that over time to see if it keeps going.
Go.
Exactly. That tells us just how far off the patient's blood pressure is from what's considered normal. We can track that over time to see if it keeps rising.
I got it. So what about the pulse? It's 110 BPM here on my notes. And the normal rate is 60 to 100. That's 10 higher than the normal rate. Is that okay?
Yup. Just subtract 100 from 110 and you get 10. That tells us it's elevated but not super high. Still something to keep an eye on.
So basically you're telling me we're using math to figure out how much numbers are off from the normal rate. Am I right?
Exactly. By doing that, we can see if things are getting worse and make decisions faster. It's all about spotting patterns.
CJ, I don't really quite enough understand it. Can you help me imagine another scenario?
Well, let's think of another one. How about calculating dosage? Let's think about that.
Alright, next step is paracetamol according to the figure. Doctor's order says paracetamol 375 milligrams per hour. Let's see what happens now. Okay, I need to calculate how many ml we need for 375 milligrams. So 375 is needed, divided by 250, which is our stock, times 5, which is the BP. So that's 6.5 ml. Okay, 6.5 ml of the syrup. Got it. I'll draw it now. I'm still looking. How is the medicine preparation? Okay, 40 ml. I am preparing paracetamol 375 milligrams orally. So the stock is 250 milligrams per ml. Per 5 ml, and I calculated the dose as 6.5 ml.
Okay, so I did it.
Okay, so I did 375 milligrams times 5 ml, and that's equal to 1,875. Then I divided it by 250 milligrams. So 1,875 divided by 250 is equal to 6.5 ml.
Good effort on setting of the proportion, but let's double check. Because your math seems just a bit off. Your proportion is right. So it should be 375 divided by 250. 250 times 5. So it is 7.5.
Oh, it's 7.5 ml, not 6.5.
Yes, we're close, but the 1 milliliter difference in pediatric or frequent dosing can be significant, especially with medications like paracetamol, where overdosing is a serious risk.
I see, I must have been wrong.
That's why we always double check. Combination is critical, especially in media or weight-based dosing. Don't rely just on instinct. Confirm with your reference and calculator every time. What happens if you only gave 6.5 ml?
The patient will have received only 325 milligrams instead of 375 milligrams, and that's underdosing.
Exactly. It may not seem like a huge difference, but consistent underdosing can affect the therapeutic outcomes. Worse, inaccurate dosing can delay recovery or require additional meds. So, what do we do now?
So I will correct the dosage to 7.5 ml and update my notes. And I'll always recalculate using the ratio method and confirm with the tracking.
Alright, make sure to always double or even triple check. When calculating dosages, just make it sure.
Wait a minute. We actually use math for administering medication. I really thought it was just by reading the doctor's order and the medical ticket.
Yes, we absolutely need to calculate proper dosage based on the physician's order, the medication available, and the concentration of the stock. It's not as simple as just following what's written on the label. A mistake in dosage could lead to serious consequences.
That's definitely concerning. I didn't realize how much important it is to really understand the importance of math. But by just being 1% or 1 ml off can really have a big impact on the patients.
Precisely. It's essential to understand and apply these calculations to ensure patient safety.
I see.
How long have you been here? I swear, my butt's molded into this platform, bro.
2 hours and 16 minutes, but who's counting?
This place is so boring. Even the ceiling tires looks tired. Hey, Kyra, have you ever noticed that evacuation plan? It's really satisfying, right?
What's satisfying about it? It's just an evacuation plan.
Not the evacuation plan itself, bro. Look at the edges, the frame, it's like perfectly balanced.
I'm confused. What if we go near it?
Oh, sure, why not? It's getting interesting.
Okay, let's go.
Okay, eyeballing here, eyeballing there, eyeballing everywhere. Maybe 13 inches tall, 8 inches wide. 13 divided by 8 is 1.625. That's close to the golden ratio.
You're bored enough to do math. Should I be worried?
No, seriously, the golden ratio is like 1.618. It's everywhere in nature. The galaxies, the pine cones, the shells, and apparently in hospitals.
In hospitals?
In hospitals!
Now you've got me curious. Do you see that window? That tall and skinny window?
It's interesting in nature.
Yeah, exactly. Let's guess. 98 inches by 60?
Wait. 98 by 60?
It is 1.63?
No! Oh, those tiles on the floor.
I know what you're saying. Look, those tiles on the floor 160.
inches tall and 13 inches wide. That's like 1.615. Damn, that's so close.
Damn, ain't no way. You think they planned all of this? Or maybe we just cracked the code. The Da Vinci Code! The Da Vinci Code is a hospital!
Direct Ace, what are you doing? The locker's been calling you.
Oh, very things are about to get interesting, bro.
Let's check the exam groups. Maybe they have spiral proportions too, and maybe it'll be more interesting.
Okay, let's go.
But
You know, CJ, I didn't know that math is such a big thing in nursing. Just really thought it was administering meds, taking care of patients, checking vitals. So annoying.
Yeah, I get it. When I first started, I didn't expect to be doing so much math either. But the more I think about it, the more I realize that every calculation we do directly impacts patient safety, even in those you just mentioned above.
It's crazy, right? Not only is it about compassion and communication, but also hands-on care. The math, so annoying.
It's easy to overlook, but math is embedded in everything we do.
I guess in the real world, everything is applied to using math. You thought after school you're done with math, but also nursing, there's always math. About meds, vitals, taking care of patients, charting, and everything.
It might seem overwhelming at first, but once you get used to it, the math becomes second nature.
Thanks for enlightening me about this. I've gained a lot of insight of how math is really truly everywhere, and I can never really escape it. It's so annoying.
So whenever you ask me again how I feel, please remember my answer is you. 먼 길을 다시 돌아간다 해도 난 여전히 같은 맘일 테니까. We'll be alright, I want to try again.